Hello, everyone, and welcome to session 7 of the Friendly Pharmacy 5 book club. It's so good to have you here. We've been going through the evidence the scientific evidence for the microbiome, different treatments. We've been discussing probiotics. We've had a number of guests on the channel over the past few weeks, and it's just been a real honor to have you here as well. All those that have joined us, I want you to know how much we really appreciate your engagement. We appreciate the fact that you're here. We've had comments from people all over the world. We've had healthcare professionals, even doctors, that have been saying they appreciate the content. And the content really is here for you. And so as we're going through today's session, if you can let us know where you're from, what you've been enjoying about these sessions, and also if you have any questions, please do not hesitate to engage with us in the comments section. So the inspiration for this series came from this book called Gut Logic, which I was able to contribute to. And what we've been doing is taking some of the topics from Gut Logic and discussing them in a little bit of a deeper format. Now, the Gut Logic book, I will say, we're not trying to sell this to you, but there will be a link if you do want to purchase it in the description. But it's written in a really easy to understand format, which is part of the reason why I really wanted to bring it onto the channel. Because not only is it evidence-based, it's also written in a way that anyone can understand. And so I'm going to introduce you to the authors of Gut Logic in a moment. But first, I wanted to start off with a fun fact about the microbiome for you. So, did you know that over 99% of the Earth's organisms are bacteria? This outnumbers multicellular organisms like humans. And have you ever wondered why some people attract more mosquitoes than others? It's not about the sweetness of their blood or their skin, but the microbiome on our skin, which either attracts or repels these insects. And if you were with us in Dr. Wishmeyer's presentation, he explains this. The microbial influence extends even to mating behaviors, such as in fruit flies. Preferences and mating patterns are determined by their microbiome composition in fruit flies, and Dr. Wishheimer even suggested that this may be the case in humans, and maybe we will hear more about this in the future as the research advances. So again, I just like to thank you for being here with us. Let us know in the comments where you're from, what you're looking to learn in these sessions. Today's focus is going to be specifically on probiotics and women's health, but at the end, I will be telling you who is coming next week. We have a very special guest coming next week to talk to us about some very important topics. But first, let's bring up the authors of Gut Logic. So Graham McKenzie is here with us, as well as Dragana Skokovic-Sunjic. And it's an absolute honor to have both of you join us today. Thank you so much for being here. How are you today, Dragana?
Excellent. Looking forward to chatting again about some of my two favorite topics, probiotics and women's health.
Yeah, and
Thank you
Dragana
for
was with
having
us.
me.
Go ahead.
Thank you for having me.
Absolutely. And Dragana was also with us last week, and she gave an incredible presentation on probiotics. So if you missed that, be sure to go back and check that out, because it was quite a great presentation and some really, really good questions from the audience in that session. And Graham himself, Graham McKenzie, is also here. Graham, how are you doing?
Doing good. It's good to be back for another week. I was saying to Lindsay earlier today, Dragana, I'll be sorry to see these go. There, we've been having a lot of fun over the last number of weeks doing this. And as pharmacists, we all sit through a lot of lectures in our life, and some really exciting and some not. But I've really been blown away by the caliber of the people that you've been able to get on here.
Yeah, and it's definitely been a team effort. So I want to thank you both for all your help in making these sessions possible, and in just being able to bring this kind of education to the platform, because social media, as has actually been said in one of these sessions, is not generally the place where you will find evidence-based science, right? And so this is a little bit of an anomaly. So thank you for being open to being a part of it. I really appreciate it. Before we go any further, I do want to let you know that these sessions are not sponsored. We do not have any ties to the probiotic industry. We have not taken any funding from any probiotic companies. But I am sponsoring this session, and I do have the Friendly Pharmacy 5 podcast. And so these sessions are being supported by the Friendly Pharmacy 5 podcast. Many of you know we have a YouTube channel, but we also have all of our expert interviews and the Q&As from these sessions on the podcast. And that is available on both Apple and Spotify podcasts. So you can check those out. Sometimes people would rather listen than watch. And so this just helps to make the education that we have on this platform that much more accessible. So going back to our experts, Graham, I wonder if I could spend just a few moments with you before we let Dragana take the stage here. I understand that you made a special visit to someone last week.
I did. So, as you know, every week we give away a copy of Gut Logic. Sometimes we give away a copy of Gut Logic and Healthy Logic. And the last one just turned out to be halfway between Quebec and Halifax, which is where I was traveling to this weekend in Antigonish, where I went to university and finished my chemistry degree there way back in 1989. And I thought, reached out to her, said, would you be okay if I just dropped it off? And she said, yeah, no problem. So that's what we did yesterday on the way up here. And we had a really nice chat with Elizabeth and Paul. And she was so excited to get the book. This, you don't know what kind of reach you have when we're doing this kind of thing, but they were like a celebrity, just kind of walked up to the door and and we got a picture, and they were just so happy to see us and really wanted me to let you guys know how much information they were getting from these sessions. So Antigonish is a special place in my heart. Again, that's where I decided this is what I was going to do for the rest of my life, and I went into pharmacy after that at Dalhousie in Halifax. So it was really nice to pop in there for a few minutes.
Yeah, it's incredible to see that photo because we really don't know who we're speaking to, right? And how much reach this is getting, like you said. And I understand there was a mural, I think that maybe Elizabeth had painted or something. Can you just share that quickly with us?
Yeah, so Elizabeth is an artist that I found out, and she did a mural that I believe is on the wall behind the library in Antigonish. There it is there. So this picture was taken 10 years ago, and kind of a touching picture of her father and her daughter. So her father has since passed away, but this is them presenting to the world the mural that her mother did, and it's still there, and beautiful picture. So Paul teaches at the university, and she's an artist, so they're quite active in the community.
That's so neat that you had the opportunity to do that and actually meet with someone who has seen these and also who won a book. So that's wonderful. And
Yeah.
today we are going to also give away a set of books. So we're going to give you Healthy Logic. One person will be the winner of Healthy Logic and Gut Logic, and you get entered into the draw to win these books. These are hard copies. It's not an ebook or anything like that. You will be entered to win if you make a comment in the comment section or if you ask a question. So I encourage you to do that. And then at the end of the session, we will be announcing the winner of our giveaway. Graham, there's something else that I wanted to ask you about. So you wrote this book, Healthy Logic, as well, which we've talked about a little bit in these sessions, but I would say definitely less than Gut Logic. But given this session is focused on women's health, there's an interesting chapter that you wrote here, or part of a chapter on the subject of vitamin D and cancer. And in particular, you discuss breast cancer. So I was wondering if you could comment on that a little bit, because, there's so much interest in vitamin D, and we've covered vitamin D extensively on this channel. I did a video called The Vitamin D Dilemma that I highly recommend, because there's been a little bit of confusion over, also I would say even sensationalism over vitamin D. And I will say I do take vitamin D myself, living in, the Northern Hemisphere. But if you could share with us a little bit of your thoughts on vitamin D and what you've seen in the literature, I think that the viewers would appreciate that.
Yeah, and I think where most of the misinformation about vitamin D comes from is we're repeatedly told that there's a lot of disease states that, especially neurologic states like Alzheimer's and ALS, Parkinson's, MS, people, when they are found they have these diseases, that they are actually low in vitamin D as well. So then, the human brain naturally will go to, okay, well, if I supplement with vitamin D, then I should be able to help these disease states. And the same was true for breast cancer. And it seemed like the lower the vitamin D, the worse the outcomes were coming. And this is more observational data. Really, I think if we were able to tell people that this was true, that if you supplement with vitamin D and you were going to make these things better or even prevent them from occurring, we looked at the incidence of diseases in the equator and then in northern latitudes where we are. Great observational data, great information to try to do further study on. And there are a lot of studies out there that are really digging deep into this topic, but I really don't have anything to tell anybody to say supplement extra with vitamin D. It's always great to put yourself in the range that you should be for vitamin D, just like anything else, like B12, for example. But as far as preventing these things, I kind of lay out in the book that it's not something that we're really pushing as pharmacists to take as a preventative matter. If you want to do it to get into range that they're giving you at the lab, then great, no problem with that. We do that with all of our lab values. But as far as cancer goes, I have seen the healthiest people I've known in my life get breast cancer, and vitamin takers and not vitamin takers. And there's really nothing firm that we can give you right now about vitamin D.
And there was a little bit in the book where you discuss vitamin D and calcium. So does that seem to make a difference or not really?
Yeah, there was in one study reflected on breast density, and it seemed in one study that there was a trend towards better outcomes when somebody was taking calcium and vitamin D. Again, there was nothing really firm on that, and I still have the same stance with that I would with just the vitamin D alone. But I do definitely mention in the book a study that was done with calcium and vitamin D. And sometimes it's good just to have the information, even if it's not a hard positive study with a recommendation from it. It gives you some idea of which way we're looking right now and where we've gotten the yes or no answers from science, especially on a topic like cancer. And if it could be solved as simple as a supplement, that would be great. But we're just not there yet.
Yeah, thank you very much for sharing that because I think even during the pandemic, there was just so much interest in vitamin D and observations about, who was getting sicker, and vitamin D appeared to be
Yeah.
lower in those patients, but that seemed to be more of a correlation. And again, that video that I mentioned that I did addresses that. I do have an interview coming up with Dr. Roger Schult from MedCram where he actually talks about vitamin D levels being more of a marker of sunlight exposure, possibly, than necessarily a marker of disease, right?
Yeah.
And you
And
do mention sunlight in the book as well.
Yeah, so the dilemma there is the risk between sunlight exposure, which is okay in moderation, and the vitamin D that you would get from sun exposure. And really, to get a really good amount of vitamin D in your system, it is full on sun. It's not like some sun on your arms and face. This is like full body sun for 20, 30 minutes per day. That's difficult for most people to get. And, people that are working all day, people that just, have busy lives, it's not really in this latitude something that's really going to kind of overdose their vitamin D levels. Perhaps if you were at a closer to the equator, you would see perhaps higher vitamin D levels. And maybe that interview you're referring to would point to that.
Mhm. Yeah, so it is a topic that there's a lot of interest in, but I think the science is still evolving. But thanks for mentioning it in your book. Those who want to
Hmm.
read about it further can look at the Healthy Logic book, which was your first book. Yeah, I think that that kind of covers the topic for the moment, anyways.
Yeah.
So I don't want to delay anymore. I want to bring Dragana up to the stage. Dragana, like I said, you gave us a wonderful presentation last week about probiotics. And this week, you're going to be speaking about women's health. And, people may know that you're a pharmacist and that you are the author of the Clinical Guide to Probiotics, but they may not know that you're also a certified menopause practitioner. So you really bring a lot to the table here as far as your knowledge. So I'm really looking forward to learning from you today. And again, thank you for taking the time to be here before you're off somewhere in the world to share your expertise with others.
So again, it is also, well, thank you first of all for having me here. It's a great that we are doing this just on the weekend of Mother's Day in Canada. So celebrating definitely women's health. And yes, I've been a menopause practitioner certified by Menopause Society for the last 22 years. So I've been definitely working with patients that are going through all different kinds of issues related to women's health, being, PCOS with the younger population, perimenopause, menopause, and, utilizing all different kinds of approaches, everything evidence-based. And I always like to say evidence up to date, because as Graham said, we keep learning more and we keep learning new things as the time goes by. And we have to adjust our teachings, our therapies, our approaches based on latest evidence. And always fighting the misinformation and very loud voices on irresponsible marketing and everything else. So as a pharmacist, we have an oath to put the patient outcomes, patient first, and practice based on evidence. So thank you for having me today to speak specifically about potential use of probiotics in women's health. So I believe I can probably start sharing my slides. If we are ready, that's perfect. I definitely encourage you to type your questions, put the questions in a comments box, and we hopefully will have enough time at the end to answer all of your questions. But today, as I mentioned, I'll be talking about women's health and probiotics, two hot topics, and kind of seeing what is the science and what's science fiction in this whole area. And there are many issues that ail women. Women suffer from IBS more than men, for example. There are some mental health issues that women have as they approach perimenopause and menopause. Cardiovascular issues become more prevalent as we age, osteoporosis, etc. So I cannot talk about all of them, but I will look through some of the issues that we do have evidence for interventions with probiotics. So starting with the first, I would say, topic and first interesting area of women's body is vaginal and urogenital area, which is unique for women. So vaginal microbiome is something that has been the topic of lots of research. What bacteria lives inside vagina or the urogenital tract of women, and how different that is from other parts of the body. Here is something that just illustrates that we have bacteria that are living very happily and helping us inside our mouth. We have it on our skin. We have lots of it in our gut, in the small intestine and large intestine, and we have lots of different bacteria in our vagina. And this is just showing the percentages of lactobacilli as a big family of different kinds of bacteria, but belonging to lactobacilli genus, they are most prevalent inside vagina as compared to other areas of the body. And when we start looking at why we need this lactobacilli prevalent bacteria, because they are actually protecting us. They are protecting us from different kinds of pathogens, maintaining proper pH levels inside vagina. And if we disrupt that kind of microbiome inside vagina, we do have increased risk of developing, allowing pathogens to become, to cause a problem, to cause infection, such as bacterial vaginosis or BV, which is again prevalent in women, especially in younger women. Urinary tract infections that can, the prevalence varies from younger to later in life. And vulvovaginal candidiasis or yeast infection, vaginal yeast infections can be very prevalent depending on health state, diet, and etc. So we do know that we have bacteria sometimes very close to urethra and other parts, but the vaginal tract and vagina itself is a part of our body that has most of the bacteria. And then looking at what bacteria is in there and what role it plays. We do know there is impact of estrogen. Estrogen, as being one of the steroid hormones, we release more throughout childbearing age, and they start kind of going completely off the rails in perimenopause, and then we bottom down in a postmenopause. So the estrogen basically allows the release of glycogen by the epithelial cells lining vagina, and that glycogen is then converted or fermented by the lactobacilli or friendly bacteria inside vagina, and basically they produce something called lactic acid and other byproducts. But lactic acid is extremely important because it changes the acidity or pH levels inside vagina, which basically protects vaginal tract, urogenital tract from many different influences, bad influences from viruses, fungus, and other bacteria. So that kind of a low vaginal acidity is seen as indicator of a healthy and well-preserved vagina. So to learn more about all different kinds of bacteria that is living inside vagina, there are numerous interventions and numerous studies and I would say consortium of researchers looking at what's happening there. I'm showing you here the project called ISALA or ISALA. It's happening in Belgium. It's been going on for a couple of years now, and it's government-sponsored and supported project where women can actually send a swab, vaginal swab, and researchers analyze it. So they have around 6,000 participants, and the numbers are growing. And not only they are collecting swabs and analyzing what bacteria is present, they are at the same time asking women to share their dietary practices, share their hygiene practices, the health backgrounds, all different kinds of other things that can impact vaginal microbiome. It's been collected and analyzed. Up to now, it's very interesting that findings from that study are just supporting the fact they are all unique and different, and it's really difficult to find the patterns to say this person has no symptoms, seem to have fairly healthy vaginal composition of microbiota, and it's not really practicing what we would think as a healthy practice, to support vaginal microbiome. So the jury is still out, and we'll be learning more about results of the study as they analyze more and more. This project also is gone international, so there are similar projects in Peru and in Panama, and with again asking women to share their vaginal swabs along with their history and practices to analyze data and learn more. So this is something that, again, it's voluntary. Patients participate, free of charge. They send the information. They do get information back, and their data, they understand the data is used for study. So one of the interesting findings from the ISALA so far is, as I'm showing you here now, in green are the genus and species that were found in these swabs. Green are what we believe beneficial, and red are those that can actually cause infection for a woman, but also infection if the woman is delivering a baby, for example. So it's interesting that some of the patients will actually carry pathogens and have no symptoms at all, and others will have seemingly healthy composition of microbiome in the vagina and present with symptoms. So still lots of diverse compositions, and we do not know what is that kind of ultimate healthy vaginal microbiome should be looking like. So again, still lots to learn. So this goes along with what we talked about before, that each of us has this unique microbiome, and we need to keep that microbiome diverse, abundant, and well fed, as we talk about microbiome in a gut. And, with the vaginal microbiome, we do know there is dominance of lactobacilli, but it's definitely difficult to do research. We can do some of the research with the proven strain and safe strains, but we really cannot do animal studies because composition of a vagina is really not something that can be replicated in animal model for the research purposes. Sometimes we do use mice or rats to do pilot studies to find out mechanistic things about probiotic interventions, but then maybe we can advance to other mammals, but then we will do maybe human studies. It does not really work for the applications for the vaginal microbiome manipulation. So again, also along this line, I like to share some of the interesting things that are happening. As I mentioned, the ISALA study and similar studies are collecting swabs that women will do at home and then mail it in for the research purposes. However, there is more and more products or programs that are offering at-home testing for the vaginal microbiome. So I like to touch base on that very briefly. When women present with some issues, vaginal issues, and maybe at your doctor's office, they are unsure if it's a yeast or bacteria or something different, they will actually do a swab, send it to the lab to analyze and get proper results that will determine diagnostically what the problem is and what treatment to use. However, these at-home testing kits are different. And I'll show you some of those. First one is called EVI, and it's like different kind of sequencing test for your bacteria that you collect from your vagina. As you can see, these tests are very costly, and they are also being promoted as being done periodically throughout the year. So you subscribe and you do the test every 3 months. And they offer some of the virtual support, lifestyle advice, etc. But you have to keep in mind, these are not diagnostic tests. They are not really analyzing if you have some pathogen or what to do. Most of the time, they would actually end up promoting or selling you some kind of supplement to fix your vaginal microbiome to make it normal, which, as I mentioned earlier, we don't know at this point what is the normal vaginal microbiome. So this is one example. And the other example is Juno Bio or Juno. And again, similar, slightly different sequencing test, a little bit more costly. And for this particular program, it's not diagnostic, and they do usually sell you either boric acid suppositories or vaginal capsules and some probiotics they make. What is interesting with this particular test is, and some of the other tests, they might be collecting data to analyze and research for the and publish as a study, which is basically something similar that ISALA is doing, but at this point, the patient is actually supporting and funding the research, funding the study. So it's a bit interesting approach, I would say, to say the least. So the big questions about is the biases, the ethics of it, who is having access to this information, and what is actually purpose for analyzing and collecting such a large data where the patient himself or herself actually is paying for that. So again, something to keep in mind. Previously, we talked about the gut microbiome at home testing as well, and Dr. Damianos and Dr. Wishmeyer, both of them said that this is not ready for the prime time yet. So with anything else, with any issue, surrounding microbiome, we always look at probiotics. Is there a role for probiotic intervention for some of the issues that we mentioned? So starting with, just as a reminder, what are probiotics? We had many sessions so far, and I believe every time we mentioned that probiotics have a specific definition. They are live microorganisms that, when given in adequate amount, would provide a health benefit for the host. Not every live bacteria is a probiotic. Not every beneficial bacteria is probiotic. So keep that in mind to begin with. And again, this is the most up-to-date definition of probiotic. And being a pharmacist, I always like to repeat that. So when it comes to the probiotics in vaginal health issues, what is the evidence? What have we done so far, and what have we used so far? So as an illustration, I'm going to show you here is just a snapshot of the vaginal health table in a clinical guide to probiotic products available in Canada. It's a very short list. In Canada, we do not have too many products, and some of them are oral capsules that would be taken as a tablet or capsule, swallowed, and they would have effect on vaginal health. And others are vaginal capsules or vaginal ovules. A little red maple leaf basically tells you that this particular indication has been reviewed and approved by Health Canada. So that is Canadian table. I will show you the US guide that vaginal health has more products. Again, US market is much larger than Canadian, and they have more offerings, more products. What is interesting that in the US, you have mostly oral capsules. And the reason for that is that if you have a vaginal probiotic that is designed to treat or prevent issue, it becomes a drug. So it's completely different regulations and process to get approved. It's much more costly. So this is why, unfortunately, vaginal probiotics are not prevalent and not really used so much in US. So digging deeper in some of the products that we use for the vaginal health. What I like to just start off with two different strains, and there are very interesting strains, old strains, well researched, and I'll just briefly go through some of the studies with you today. What is also interesting that there are two strains that are researched together. So as a I'm not sure, like two bodies working together well, research with one only and or the other is not so impressive. What also is interesting that first strain, Lactobacillus rhamnosus GR1, is actually isolated from distal urethra of a healthy women. And then we kind of grow it in a lab to have a whole cell line registered and well preserved. And that particular one supports a healthy vaginal lining. It can be found in vaginal lining even after oral administration, and produces these kind of toxins for pathogenic bacteria inside vagina. The second strain, L. reuteri RC14, has been also isolated from the vagina of a healthy woman. Again, preserved, and then cell line is registered now. And that one, also after the oral intake, can be found in vagina and produces hydrogen peroxide, which again supports that healthy pH level inside vagina. So let's very briefly look at some of the studies done with this particular combination, 1:1 equal parts of these two strains. Some of the initial studies were done by Dr. Gregor Reid and his group at London University in Ontario, Lawson Institute. And what they started first, they were giving these strains to healthy women that have no issues, but then they followed them for 60 days and measured if those women will actually develop bacterial vaginosis. So to see if this particular intervention would prevent bacterial vaginosis in these healthy women. Bacterial vaginosis can be very prevalent, especially in the women of childbearing age. As you can see, in the probiotic group, after 60 days of taking this particular probiotic combination, none of these women developed the bacterial vaginosis. And in the placebo group that did not take any probiotic, 24% of them developed bacterial vaginosis at day 35. And when they continued, 16% by day 56. So this is one of the initial studies. Then the same group had expanded this research, looking at similar duration of treatment, 2 months, and they were giving the same combination, 2 of these strains, to women that, premenopausal, basically, childbearing and perimenopausal, and they are finding the same results, that bacterial vaginosis prevalence was reduced in probiotic arm, and again in the placebo arm remained unchanged, kind of followed the general population. So showing the reduction of the prevalence and a risk of developing bacterial vaginosis. A different group also use the same combination, giving it to women that have been diagnosed with bacterial vaginosis. So basically, it was used as a treatment. And this was multi-center with larger group of women, and they were giving this particular probiotic combination for 6 weeks. Similar results, not surprising that in the probiotic arm, the restitution and returning of the vaginal microbiome to normal state was much faster, and clearing out of the symptoms of bacterial vaginosis was much faster. I'll just keep going very quickly. There are a few studies that looked at giving this particular probiotic combination along with a standard therapy that we use for treatment of bacterial vaginosis or the yeast infection. So if it's bacterial infection, we would use antibiotics, usually locally, metronidazole or tinidazole, and if we provide the probiotics along, the results are much better and much faster eradication of these symptoms. And similarly, fluconazole that we use for yeast infections or vulvovaginal candidiasis, if we administer it along with the probiotics, we get better results. So from there, we also did some studies with using probiotics to minimize the risk of urinary tract infection, thinking if this probiotic combination of those 2 strains is working to support healthy vagina, how about the rest of the urogenital tract? So the researchers have done study looking at giving this combination of strains to minimize the recurrence of the urinary tract infection, or UTI. So basically, is using this probiotic as a prevention for the bladder infections. And what I also measured antibiotic resistance in those patients that we sometimes need to use the antibiotics, and we end up with running out of options because those bacteria will develop resistance. So the study had interesting design. So basically, that was a double-blind dummy study with the non-inferiority. So we had 252 postmenopausal women, so older women with recurrent urinary tract infections. And for that population, we only have options of antibiotics, sometimes low dose, long term, which will then cause other potential problems and complications. This particular study was 12 months and with 3 months follow-up. And we were looking at incidence of symptomatic infections and also looking at antibiotic resistance. So what the results of this study was that both groups, antibiotic and probiotic, reduce the incidence of bladder infections. Statistically looking, the non-inferiority target was not reached. But again, as you can see, that the treatments were equally effective. And what is also even more impressive that we, using antibiotics, we then ran into the development of antibiotic resistance. So this bacteria stops paying attention to the treatment and then starts thriving again. However, that was not the case if we were using probiotics. There's really no antibiotic resistance developed in that group. So very encouraging data from that particular study. And I can tell you that, we've been recommending this particular combination to our elderly patients with the catheters, with the other complications, with the great results. So going forward to using probiotics in menopause. As I mentioned earlier, that in menopause, we do have the drop of estrogen. Estrogen does play a role on that release of glycogen inside the vaginal, inside vagina by epithelial cells, and supporting the normal health of the vaginal lining, with providing the food for bacteria there to change the pH level. What happens if we do not make enough estrogen and then we do not have that process ongoing? There is something that we use to determine the health of vaginal lining and what's happening inside vagina. So here is just different kinds of issues. It's different kinds of horrible things that happen to women when this decline in estrogen. We lose our collagen, we weaken the vaginal walls. There's increased risk of stress incontinence, pelvic organ prolapse. But again, we do not provide enough energy sources for lactobacillus, and again, changes in the pH level happen, which can lead all to dryness, irritation, increased risk of infections, and dyspareunia. So what we use to measure the Nugent score is something that we use to measure different kinds of bacteria inside vagina, and lower the score, it's the better. So 0 to 3 is a normal score, 4 to 6 is kind of intermediate bacterial count. But if you have very high Nugent score, it indicates bacterial vaginosis and potential problems. Why I'm telling you that? It's something that another group of researchers did a study using the same two strains of probiotics to see if it can affect and improve Nugent scores in postmenopausal women. So basically, they selected 72 healthy postmenopausal women, and they had this intermediate Nugent score of 4 to 6, and they were measuring the changes in the Nugent score. So for that particular study, they found that after 14 days of probiotic interventions, there was reduction by at least 2 grades in a group that was taking probiotics. So these women did not have any symptoms, but they were at risk of developing symptoms, and we actually minimized the risk of potential problems by giving them probiotic for 14 days. So moving from vagina to other parts of women's body that are specific for women, breastfeeding. I'm not sure if any of you ever thought about using probiotics as a breastfeeding support, but I'll just touch very briefly on mastitis and probiotics, which is something that affects breastfeeding mothers. So when we talk about breastfeeding, and we know that breastfeeding is very important for baby, that breast milk provides the food for bacteria in the baby's gut, and also provides some bacteria for baby's gut. It does improve health outcomes for a baby later in years. And again, most of women would love to breastfeed to at least they have a good start for the baby. So sometimes there's not enough milk, there's some other issues affecting the milk supply. And some of the signs of low milk supply is that baby is not content after feeds, it's crying frequently, or it's maybe not alert, it's not active, it's not meeting developmental milestones, has usually poor weight gain, and decreased diaper changes and output. Those are signs of low milk supply. Many factors can affect milk supply. in the breast. So, starting from, PCOS, obesity, smoking, having breast surgery, losing blood during the delivery, different kinds of abnormalities, like thyroid disease, etc. And then, some psychological issues, exhaustion, stress, depression, medications, soreness of the nipple, engorgement, and mastitis. It's something that has a huge impact on ability of the mother to continue breastfeeding. So mastitis itself is basically infection that happens to the breast tissue during breastfeeding. And it causes the discomfort, pain. It makes breastfeeding extremely challenging and, quite often impossible. What is interesting, it is fairly prevalent. Up to 10% of new mothers will experience mastitis while breastfeeding. And it is common reason why women will actually stop breastfeeding, because they just cannot put up with that. The approaches we have right now as a treatment is always using antibiotics to clear the infection, which then we would have to stop breastfeeding because of the antibiotics most of the time, and then resuming breastfeeding after period of time or a couple of weeks sometimes is challenging because baby is not latching properly, milk supply goes down, etc. So looking at using probiotic intervention, after multiple attempts, one specific strain was identified as extremely helpful. It's Lactobacillus fermentum, CECT 5716. Again, all those funny strain names that nobody can ever remember. But this specific strain was tested, for example, compared to the antibiotic treatment. And as you can see that, definitely the breast pain scores went down with antibiotic, which is expected, but also with probiotic as well, fairly significantly. The same strain was tested for treatment and for the prevention of mastitis with the great results. So it's something that has been identified as potentially beneficial for women that maybe have had mastitis in the past with a previous child, or have high risk of developing mastitis. It can be taken as a prevention, or if they develop mastitis, it can be given as intervention or along with antibiotics. So definitely something to keep in mind. So when we talk about these probiotics, and as mentioned, these complicated strain names with the emphasis on the last part that is definitely the most challenging, how do we know what to recommend? How do we say to our patients, or how do we select what we should be using to treat any of those issues? We do know that efficacy of probiotics is strain and disease specific. Here is just a quote from a great meta-analysis that there's a strong evidence, but we need to know what we use and for what reason. So not all probiotics are the same. This is a message we've been repeating throughout the last 6 sessions. And, I guess it's always good to repeat this again. We cannot tell our breastfeeding mothers, go and get some probiotics, you will be fine to prevent your mastitis, because it might not work. There's only a single strain with the evidence for this particular reason. So as a quick reminder, probiotics in the name have the genus, species, and the last part, which is a strain. We need to know all 3 parts. And to make your life easier, again, we did come up with this guide, with the probiotic products guide, and we talked about that over the last sessions. It's something that's been created 16 years ago. We've been doing it in Canada since 2008, and for the last 10 years in the US as well. We are anticipating to expand to Europe as well. Basically, what we do, we tell you, here are the studies for this particular strain, and here's the product in your region, in your geographic area that has this particular strain. So basically, to access these guides, you can get a printed copy. You can actually access it online. I did share some of the screenshots from the websites. US Probiotic Guide is US site, and probioticchart.ca is Canadian version. These are also available as a mobile apps, interactive. You can search by indication. You can look up the brand name that you are wondering what can be used for. And again, you can see all those references I have in little footnotes on my slides are listed in these resources here. Again, I'm showing you a page from the printed copy of the Canadian guide with a short list of the products for maternal and vaginal health, and somewhat a larger list for the US version, because again, in US they have more products. What's also interesting, there is actually a product also for prevention of gestational diabetes in pregnancy that is available in the US only. So I do encourage you to check the guides, see what's listed for women's health, for vaginal health, and other issues related to and prevalent in women. We have at the APROBio, which is Alliance for Education on Probiotics, which actually supports the publication of both clinical guides. They also produce all different kinds of patient education, leaflets, and additional webinars and information. And here I'm showing you one of those one-pagers for the vaginal health, which basically talks about things that I mentioned before. On the back of that page, you would have a list of products that have been proven effective for either bacterial vaginosis or yeast infections as an intervention. So I do encourage you to check the aprobio.com website to look at those resources. So to kind of conclude my portion of the talk, I like to talk a lot and I like to talk fast. So I hope you'll have lots of questions to answer. So when in doubt, use the guide. Check what's in the guide, research it, see what products they have. Beside each product, you can actually click on a little button and open all the studies and see, read more about the how they use it, how long, etc. If you like to actually see more about learn more about using probiotics as intervention. So with that, I like to thank you. I'll finish with my slides. I don't think we need to see them anymore. So back to Lindsay and Graham, and to see if we have any questions or comments to answer.
Thank you so much for that, Dragana. That was very interesting. You shared a lot of information in a short period of time there. You're not talking too fast. We can understand, and I think we're able to at least remember some of that. So thank you for that. I think one question that came to mind that I wonder if the viewers are having right now might be, how can taking an oral probiotic affect the vaginal microbiome? Can you explain that to us? Because
so this is really interesting point, and again, very often I hear from fellow researchers, clinicians, even people that maybe are presenting, saying that we have to look at the skin microbiome separately, oral microbiome separately, vaginal. It's all separate. No, it's not. It's all connected. Dr. Gregor Reed and his group actually published a specific paper to explain the mechanism of this, how taking something orally will actually affect the vaginal microbiome. So I do encourage people to maybe we can even put the link to that particular paper. But yes, you can take something orally if these bacteria, as I mentioned, they were isolated from healthy urethra and healthy vagina. They like to be where they feel at home. So they will find a way to get there. They do not go through blood. They never go through blood. But, by passing through the digestive tract unchanged, they will get to the vaginal, the vulvar-vaginal area, and they'll find a way and stay in the vaginal area. It's definitely fascinating.
It is fascinating, and I know that Graham did cover that in his book as well. That's why I didn't ask you, Graham. So it is in the Gut Logic book. But Graham, any thoughts or questions for Dragana? And if viewers, if you do have any questions, now is the Q&A portion of our session. So feel free to throw your question into the comments. It'll enter you into the chance to get your own copy of Gut Logic and Healthy Logic by Graham McKenzie. And we love to hear from you. So even if you just let us know where you're from or what your biggest takeaway was from Dragana's presentation, even if you don't have a question, just let us know in the comments. We'll enter you in. But Graham, any thoughts?
Yeah, I just have a couple of comments. I mean, as you know, and I could go on about Dragana all day. I mean, we could have these talks every single week just from her, and they would be amazing. And I think one of the things she mentioned, and we talked about it in the book, as pharmacists, we know that chronic urinary tract infections, especially as women get older, can be more prevalent. And there's not a whole lot we have, I guess, aside from vaginal estrogen to help prevent that. We did mention in the book about the RC14 and GR1, and with the antibiotic stewardship that we follow as pharmacists, this is a really good way to help cut down on the amount of antibiotic that we use. Because there's some women that just suffer with this every, few months. It's another UTI that they're getting. And I think of all of the things in the book that I found hope with probiotic, it was with urinary tract infections. And I know we're not giving out brand names or anything here. It's really hard to educate without giving out brand names, but I have given this combination to women for bacterial vaginosis and UTI, and it really does work well. So I'm glad that you brought it up this evening, Dragana. That's a really huge help, not just for women that have UTI, but for every other woman out there that is trying to prevent resistance from bacteria from happening. It's kind of a gift, really, when you think that taking a simple probiotic, which you don't even need a prescription for, as long as you get the right one. And I think you stress that you have to get a specific one. As long as you can get that, then it could be a huge help for you. So anybody prescribing, a pharmacist, a dietitian, anybody out there that you can just go to that guide and make a recommendation. It is so easy to follow. And I use it myself, every week I use that guide at work at the pharmacy when making recommendations.
That is correct. And one of the things that products, as you mentioned, are available without prescription, over the counter, or non-prescription. So it's easily accessible either in pharmacy or online. And again, people are bombarded with marketing. And I get in my live feed of Instagram, oh my God, and I see all those probiotics that have been promoted with no evidence. So it's challenging for patients to understand and to actually select appropriate one, in combination with women's health being also hitting the prime time. Women are target of different kinds of marketing of different kinds of products. I've seen probiotics being promoted for menopausal symptoms, for osteoporosis and other things. We are not there yet. We do know there is a bit of a correlation with the estrogen metabolism in the gut. We are learning more about it, but at this point, as intervention, probiotics, we are not there yet. Good diet, balanced diet, yes, for overall health, but using a probiotic to minimize your hot flashes, not there yet.
Yeah,
Good point. And I think, sorry, Lindsay,
no.
I think the general public knows that probiotic is something that perhaps they should be on, and physicians are even coming around to that. But you're right; it's almost like, yeah, if you just grab a medication off the shelf in the pharmacy for your blood pressure and it's a gout medication, it's really not going to help you at all. So you really have to get the right one.
Absolutely, absolutely. And again, I have to also repeat what you said with the urinary tract infection. It's a huge burden for public health, for our healthcare, especially in elderly population. I'm finding that, nursing homes and, there are daily prescriptions for antibiotics, and we are not getting better with this. So for women, vaginal estrogen, definitely something that we should be recommending and talking about, but does involve prescription. And again, still lots of prescribers are hesitant to do that, even though lots of education is being gone into that. And women are scared of hormones still, even though vaginal estrogen does not have any, for most patients, does not have any problems. So yes, that's kind of a challenge. And, as a pharmacist, it is our responsibility to educate patients and prescribers in this area. Absolutely.
Yeah, and I think I mean, there was almost a move to try to push to have vaginal estrogen over the counter, which would really do a lot for UTIs. But I think that day is kind of long in the future. But getting to the antibiotic that you mentioned, that study Septra, it's that antibiotic is the one that comes up almost more than any other for interactions that we have to deal with. And the trimethoprim that's in that has the same effect in the tubule in the kidney, almost like giving spironolactone does. So the potassium interaction with that comes up a lot, and there's a lot of calls to the doctor quite often when it's interacting with another medication that would affect. So the least amount we have to use for antibiotics, the better.
I also like to say something else. This particular combination of two strains for prevention of UTI, we are observing, this is not published study, we are trying to actually publish as a case reports. They are working for men as well. And we have lots of men that are with indwelling catheter or intermittent catheterization, with ending up in a hospital because of the bladder infection. If we provide them or recommend this particular probiotic combination, they are free of symptoms. They do not get urinary tract infection. So
Wow.
it works for men as well. Yeah, that's very, very interesting. I'd like to see some larger study, of course, but we, as I say, we collected some data and we might publish it as a case report.
Yeah, it really shows how interconnected your microbiome is all through your body. That taking something orally could affect something in your bladder, but it happens. Like that's exactly how it works.
Yeah, there's educators, two sisters, I think from UK. They say, what happens in a gut does not stay in a gut. So it's not like Las Vegas.
Yeah, no, it's important to discuss that. And I was going to say, and you covered this, Graham, was that these antibiotics are not without side effects, right? And it can be very complicated to
Yep.
find the right antibiotic that is also not resistant, like Dragana was talking about, the growing issue of antibiotic resistance. So having a probiotic that can possibly resolve this issue and reduce the recurrence can be really life changing for
Yeah,
people.
exactly. And we had this discussion at the pharmacy just last week that how often do we get a Septra prescription, and you can almost flip a coin, and that person is on an ACE inhibitor or an ARB that will have that interaction with the potassium, compared to, I suppose, a simpler antibiotic like amoxicillin or Keflex. So, not to mention the other adverse effects that could potentially happen too.
Yeah. I just wanted to share some comments. We have people watching from all over the place here. So Siri Carlson says, watching from Staten, Oregon. Thank you for presenting this important information for women. Thank you, Siri, so much for joining us today. It's wonderful to have you here. This is the Q&A portion of the session, so feel free to send us your questions about women's health. It doesn't necessarily just have to be about probiotics. I think Dragana would be comfortable answering questions about women's health in general. She is a certified menopause practitioner, and she's a wealth of knowledge. So take advantage of the fact that she's here with us. Marina Smith says, are there any probiotics that have documented studies showing efficacy? So we've covered this in some previous sessions, and then the AE ProBio guide that Dragana was speaking of. Maybe, Dragana, could you just tell people again maybe what the guide exactly is to maybe answer this question?
Sure. So this is exactly, Marina, what we are actually doing. We look at the probiotic studies, and we look at the studies that used a specific defined strain or combination of strains in a human population, and they measured the outcomes. So they measure that something changed for this particular patient group. So they had less symptoms, or they resolved symptoms, or they prevented symptoms of some issue. And so we know what happened to these patients, and it's statistically significant. Those studies we actually review, we gather them all, we review them, and we say, okay, this particular strain is available in Canada, and this is called so and so. It can be found in shelves or purchased online under this particular name. And this our group of reviewers adds this particular strain or product to the guide. So then when you access the guide, you can see what strain was present, what is the name of the product that has this strain, and what this strain can be used for. For example, irritable bowel syndrome symptoms. And then you see also additional information which assigns a level of evidence. If the study was large, well designed, really great results, we assign level 1 evidence. So it's a golden standard study. We give them the highest level of evidence. If it's a smaller study, maybe not placebo-controlled, double-blind, but again, important results were observed, we maybe assign level 2 or level 3 or recommendation. And what we also put in this guide is references. It means we give you the name of the study, the authors, so you can actually easily search this particular study if you like to read it, just to see, what is the population age, what is geographical area that was this tested in, etc., if you would like to dig more and dig deeper for the information. But basically, if you're looking for simple information, you will find in the guides the issue that is bothering you or symptoms that you like to relieve. And if they are listed, you can actually do the search and find out what products have been tested and have evidence for it. So this is basically was initially designed for healthcare professionals to help them navigate this confusing field when recommending probiotics to patients. But we are now finding that more and more patients are accessing the guide because these products, they don't need prescription for. They can actually go and buy it, even though we suggest that you check with your physician, with your healthcare provider first. Do not self-diagnose the issue, but if you know the diagnosis and you like to try something over the counter, specifically probiotics, you can select one with the best evidence. So not all of the products are listed there, only those that have evidence in human population.
Yeah, and I think the best part of that site is the references, which are right there at the point that they're recommending the product. And number 2 is the levels of evidence. It'll be 1, 2, and 3. So you will know right off the bat. It's so intuitive to use, not only what product, but exactly why it's being recommended.
Yeah, and sometimes, for example, for IBS, you would find products that come in capsules or powder, or they come as a milk fermented product with added probiotics. So depends on your preferences, you can actually pick and select a product that is convenient for you. Some of the products are once a day, some twice a day. So then you select whatever is more convenient for your lifestyle.
And it's a great question, Marina, and thank you for asking that because, even as pharmacists, and we've talked about this in these sessions, it's overwhelming the amount of probiotics out there. And when you go to the probiotics section of a pharmacy or a health food store or a big box store, I mean, how do you know what to choose? You just, and often we'll go to the one with the nice label that talks about the issue we're having. And it doesn't necessarily mean that there's evidence behind it, right? So before you go, talk to your pharmacist or go to the guide and look for the issue if you do have a diagnosis, if you know what you're dealing with, because this is a problem now. Like Dragana was saying, this guide was designed for healthcare professionals, but we know that people are self-selecting these products as well, and sometimes they're sent directly from their physician's office. Just go get a probiotic. Right. And Dragana, you mentioned today, don't do that. That's not necessarily going to help your issue. Right.
And some of
Exactly.
those, I've noticed those products, some of them you can't get them really in every single pharmacy that you're looking for, right? These are specialty accounts that some of these companies are making. In fact, the one that I just mentioned with the UTI and the bacterial vaginosis, I've only seen it, and I might be wrong, but there's a recommended specific brand that's there, and I don't typically see it in a whole lot of pharmacies. So you may have to do a little bit of calling sometimes before you find it.
Exactly, or online as well. And
Yeah.
sometimes, actually, I do not like to recommend my patients from Canada order from US but I find that same product can be cheaper if you order from US. So again, if you know the name, shop around, find, because again, the cost can be sometimes issue. So
Yeah,
especially if it has
especially
been
this one.
taken chronically, chronically, you have to take it long term. So yeah.
Yeah.
That's very interesting. We have a great question that has come in here from Patty Rivers. Any probiotics for perimenopause changes such as cramps or hormonal fluctuations as things change?
I'll jump first and then Graham, you
Yeah.
add. Um, so as I mentioned earlier, in perimenopause, there are so many different challenges that women go through. Perimenopause is a time approaching menopause, which is the year after your last menstrual period by definition. And perimenopause can start in your 30s, come and go. The hormonal changes can start happening then. The average age of menopause is 51. So between 30s and 50s is a long time to suffer. Women in perimenopause suffer lots of different kinds of issues, not necessarily only the hot flashes and night sweats, but mental health issues and changes that can be devastating, non-specific. Women think they're losing their mind. So it's very, very challenging time, and we need to seek help. We need to ask and be assessed appropriately. When looking at probiotics as intervention, if you have some specific gastrointestinal issues that you would like to try probiotics for, such as IBS or something like that, constipation or diarrhea, maybe you select probiotics. But probiotics will not help control hormonal fluctuations. I might stand corrected with the years to come because there are studies and research looking at probiotic interventions to assist estrogen metabolism. We don't know yet what are these results. Results sometimes are underwhelming at this point, so we do not have intervention. Nothing listed in the guide yet, but we are monitoring the research and what's published. So stay tuned. But at this point, no. One of the things I recommend, to make sure that your gut is working and doing proper job, especially during perimenopause, where estrogen goes up and down and all around, like on a roller coaster, make sure to feed the good bacteria in your gut properly. Maybe add some ground flaxseed, which basically will allow the gut to eliminate any excess estrogen if not needed, and feed the good bacteria in your gut. So that might be good intervention as well. Well-balanced diet, physical activity, all of that boring stuff that we keep talking about is always the most effective. Graham, any other things to add?
Yeah, I think you're right. As far as specific hot flash symptoms with menopause, you're right. There's nothing that I know of that would help for that. But the other things that can happen, like oral health, sometimes with weight gain, we know that there's work being done with some probiotics with weight gain, and the things that can happen in the urogenital tract with menopause. We've already shown through this talk tonight that we can show some benefit for that. But I think the real symptoms that as pharmacists people come to us for, which most of the time are going to be the hot flashes and the brain fog and, not sleeping, that kind of stuff. We need more work to be done on that for sure before we can make a real firm recommendation.
Okay, you both. Thank you. Thank you for the answer to that question. And for those who are watching, I'm going to share a link in the description of this session to a recent, I just launched actually a podcast interview with Teresa Isabel Gias about menopause, perimenopause. She shares her journey, but she's also a menopause practitioner. And it will clarify a lot of the confusion, I think, that is out there and the suffering that is out there in terms of women who are struggling, who are in, either perimenopause or menopause and have had trouble getting access to treatment or getting someone to really listen and take their concerns seriously with what they're going through. So I will definitely share that. I'm sure you have a lot of thoughts on that, Dragana.
Oh yes, it's lots of my patients, and as I say, it's one of the tools that I have in my clinic because I work in primary care, so I see patients one-on-one, and I always tell one of the things I always have to have in my office is a box of Kleenex, because these women, when they realize that they are not alone and they are not losing their mind, it's not their fault how they're feeling and why they're feeling that way, and there is potentially some help. There's always tears. So yes, we need to talk about it. It's not taboo. It's our health and affects all aspects of our life, and we have to be proactive and seek help. So that's 100%, 100%.
Absolutely. And we have actually two interviews on this channel. We have Dr. Glenn Pyle as well, who does research on heart health and women. And he talks about menopause and how that lack of estrogen actually changes the heart and remodels the heart and some of the different aspects of that. So people can have a look at that as well. I'll link that in the description. Siri Carlson has another question here. Do foods that contain probiotics provide an adequate amount as well as the appropriate strains for different health needs? A very broad question, but generally, can you speak to kind of what we might find in food? I think in session 2, we spoke about prebiotics, probiotics, and some of the sources. But any thoughts on that, Dragana?
So, one of the things that I always say that go back to the definition of probiotic. It has to be live, adequate amount, well defined, and has to show health benefit. So we do have specific fermented milk product and oat or juice or product that have added bacteria to it, which basically serves as a carrier for probiotics. They're all listed in the guide. So those would be probiotics. But fermented foods or foods containing live bacteria are great foods, but they are not probiotic. We can only assume what strains are in it. We do not know how much. We sometimes on the label they might say a minimum of so many, but they change with time. They will die off, so we don't know how much of live bacteria is actually left in a yogurt or something that kombucha or whatever you are actually getting, because quite often they are heat treated, so there's not much live bacteria left in that food. So that's a challenge. But again, fermented foods are great food. They are easily digestible. They are amazing addition to a balanced diet. Also, when I talk about these kind of yogurts that basically are fermented milk products with added probiotics to it, check the guide, because things change in a guide as well. Sometimes if the company changes how much of probiotic they're adding to the single serving of that yogurt with probiotic, and if it's 10 times less than it was previously, we have to remove it because we cannot expect the same effect if it's 10 times less bacteria that has a good evidence present in the product. Any other suggestions and comments, Graham?
Well, I learned a lot about this when Dr. Demianos was on, and he has talked about the Mediterranean diet and how you can, not that he was not recommending prebiotic at all. It was just more from a varied amount through the diet. And some people choose to get a healthy flora, which is legitimate, by not necessarily consuming probiotics per se in a product, but they try to do it through fermented food and through the proper fiber intake and that kind of thing. And the only caveat to that is that when there is a specific medical condition that does arise, we don't really have a lot of hard evidence to recommend, as you said, kombucha or whatever it is we're going to tempeh or something to fix that. Sometimes we just need that specific probiotic to do that. But, and we mentioned this in the book too, that some people just, instead of taking probiotics, will go with the fermented food. And like Dr. Demianos talked about, that sometimes you have to modify a little bit, something like the Mediterranean diet to get to, let's say somebody has IBS symptom relief. But it's certainly a legitimate way to help improve your flora when you do it that way.
And Graham, You had mentioned dental changes, and Patty Rivers just flagged that, and she said, "What are you talking about? Dental changes?"
Yeah, and actually, I would almost put that toward like I think in the guide, Dragana, there is mention, I think, for something on dental health. Am I
Oral
right in
health,
saying
yes.
that?
Yeah. So
Yeah.
go ahead.
No, I was going to say you can take that away. There, this is not something that in my practice that I have used a whole lot. In fact, the whole probiotic approach in oral health, and Dr. Wischmeyer had mentioned this too about giving probiotic and putting it in the mouth as well. I think it was something that really opened my eyes to what was available out there for oral health. So yeah, please tell us.
So there are lots of probiotic strains that have evidence for benefits for oral health. So we call it oral health because sometimes it's a reduction of dental cavities, sometimes it's prevention of the receding gums or inflammation of the gums, like gingivitis or periodontosis, or even reduction in tonsillitis or inner ear infections. So kind of basically all oral health. And quite a few times we have this Streptococcus salivarius K12 that is in it, that has really affinity to stay in an oral cavity and provide benefits. And there are a few others, combination with two different lactobacilli reuteri. So check the guide for oral health benefits and see. And quite often there are chewable products. So basically, you deliver them and kind of keep them in the mouth to provide the best benefit. So definitely good research there and more coming. So again, we keep adding, I think, more products every year to this particular indication in the States and in Canada as well.
Yeah, thank you. That's a better explanation than I would have given, but it was really news to me, really, when I started this whole Gut Logic book, and I'm trying to filter out how many medical conditions are out there, and oral health came up as one of them, and it really opened my eyes to the stuff that I wasn't even using in the pharmacy practice that I could have been using.
Yeah, and oral health is such a huge topic, and it's of so much importance. So I'm
Yeah.
glad that we could discuss that, and it's something where I think we're learning a lot more about. I know Dr. Graham Lloyd Jones from the UK is doing a book about this. He's a radiologist from the UK, and he's trying to address just the importance of oral health and how it can leave you more prone to disease, even infectious disease, right? So,
Mhm.
um, one last question here from Elizabeth T. I think it's probably for Dragana. How much does birth control help with perimenopause fluctuations?
So, as I mentioned, with perimenopause, the hormones go crazy. Basically, in perimenopause, it's when the ovaries start releasing not good quality follicles. They do not mature quickly enough or sufficiently enough, and there's lack of production of progesterone to send a feedback back to the brain. Then ovaries start pumping the estrogen out, thinking that there's conception maybe happening, so let's get everything out. We retain water, fat, we kind of go crazy. So and then we have irregular bleeding after as a consequence, and everything is unpredictable. We never know when it's going to happen. That's perimenopause. If you are taking birth control, oral contraceptives, especially the older generations of contraceptives with normal or higher amounts of ethinyl estradiol, which is not the same estrogen that we actually make, you are actually overriding your own production of estrogen and progestogen. So this is the idea with birth control, to override and kind of just put everything on back burner. So the estrogenicity and the effect of those tablets birth control is 3 to 5 times more than your own production of hormones. So if you are on birth control for contraceptive reasons, you will prevent most of the time those fluctuations. But to use the birth control as a treatment for perimenopause changes, there might be other safer options. So that's kind of my short answer, because any kind of hormonal interventions that we do in perimenopause or menopause is less estrogenicity and less affinity for receptors than what our own production is. However, in perimenopause, there's high risk of unplanned pregnancy that can be complicated. There's lots of risk of complications then. So sometimes you do need contraception. So long answer to short question.
Yeah, I feel like this is something we could do a whole session on, or series on, or write a book about, because
Your book, yeah.
yeah,
Yeah.
it's something that I think there's just so much need for, right?
Yeah.
And go ahead.
Graham, eyes on you for the book. So that's your next book. We are
Well,
calling
I
you.
know who I'll be calling if I need some help with that one. I mean, as pharmacists, I think you realize, and you touched on this, Dragana, I don't think there's any group that would speak to you with longer conversations than somebody going through menopausal symptoms. These are the phone calls that you make time for, and you are sitting down for excessive amounts of time to try to help in some way any symptom that you can. And once that Women's Health Initiative study came out, it really changed. That was overnight. It changed how many times I would have a conversation with a woman about menopause, from almost none to almost every week. And yeah, it's a good idea for a book. So we might talk about that later.
Yeah, and if you want to hear more about that Women's Health Initiative study, again, I will put that link to the interview that I did with Teresa in this video, in this session description, because she actually mentions how she was a practicing pharmacist when that study came out, and people were literally throwing their estrogen into the toilet, which is terrible because it actually gets into the water, right?
Yeah.
It's the worst thing. And then they were coming to the pharmacy, just like you were saying, Graham, saying, okay, so now what? And they had nothing to offer these women. And since then, it's been such a battle. And you mentioned, Dragana, vaginal estrogen. How many women know that might even be an option? Like, not enough, clearly, So
And even the safety profile with vaginal estrogen, like one of the biggest concerns that comes up is women that have a family history of breast cancer, or any type of cancer. And vaginal estrogen is such a good safety profile, and it could be helping so many symptoms, including the UTIs that we were talking about. Hopefully, it'll start to come around again.
I hope so too. In some European countries, actually, the estriol, I believe, is over the counter. So some of the products can be purchased without prescription. So,
Wow.
yeah.
Well, that's
Good idea.
encouraging. Yeah, that's great to hear. Peggy Harris says, this series has been so helpful. Thank you. Thank you, Peggy. I'm so glad that you're here, and that you're with us. And you are actually the winner of Gut Logic today and Healthy Logic. So you need to email me at friendlypharmacy5@gmail.com, and we will send you out your hard copies of Graham's books. Okay. And these are excellent resources. And so congratulations and thank you for being part of this this session today on women's health. So Dragana, is there anything else you would like to share? This is a special session, and Graham, you as well. Special session on women's health, and we've taken some time out today. And this weekend is Mother's Day weekend, and as far as women's health, what are you kind of excited about moving forward, and how would you just maybe encourage women who might be, I don't know, looking for some advice as far as navigating women's health in the world we live in today?
Again, something that I always tell my patients, it is okay not to be okay, and it is okay to seek help and ask for help. Be careful, where you turn for information. It's great to exchange, opinion with your colleagues and friends and family, but seek some healthcare professionals that will actually provide you with some evidence-based information, and they have your best benefit at heart. And quite people that don't sell products or push products on you. So that's kind of one of the always red flags. If somebody's trying to sell you whatever they make, be kind of aware of that. So yes, and women, do feel neglected, ignored. There are reports and reports, and we know that it's been happening for decades, for generations. And we do carry so much on our shoulders, our families, our careers, so much is there, and we are expected to just, fade away when, we start going into perimenopause. No, claim your space, ask for help if needed, and it is okay to do that. And the last thing I want to say with the, Mother's Day, and, I have something that I got from my mother and something from I got my sisters. I know just having these two as my reminder of strong women in my life that, kind of we support each other. So yes, go women.
Mhm.
Yes, and Patty Rivers says, thank you for answering our questions and for taking the time to provide this information. You're so, so welcome. And thank you, Dragana and Graham, again, for being here. I want to let the audience know what's coming up next week. We have a couple more weeks left of this series. So I want to show you, we've gone through all of these different topics. Today, we covered women's health and probiotics. Next week, Dr. Peter Lynn will be joining us. He's speaking about early life, microplastics, and also GLP-1 agonists. If you don't live under a rock and you've heard the words Ozempic or Wegovy in the last year, that is what we're speaking about when we talk about a GLP-1 agonist. But GLP-1 is actually something that has a lot to do with the microbiome. So I won't go into detail on that. I'll let Dr. Lynn do that next week. But that's sure to be an engaging session with Dr. Lynn. So definitely looking forward to that. So I think that's all we have for today. So thank you all for joining us. Happy Mother's Day. Go women, as Dragana said. And we look forward to seeing you in the next session.
Thank you.
Thank you.